Works, and David Simpson, who is the Director of Public Works in Wauwatosa. So, County Executive Abele, would you like to kick things off?
You bet. Well, thanks everybody, and thanks again for joining. As a lot of you probably noticed, we are now over 1,000 confirmed cases as of today and 24 deaths. And as I have in the past, I want to keep highlighting the fact that the vast majority of confirmed cases for the county are still in the city of Milwaukee and African American, and ditto for the deaths. 79% of 24 are African American. So again, we need to get the message out, which you know because you've heard us say it so many times, the importance of staying home and saving lives and isolating. A couple points I want to make. First, as many of you saw, the governor has called for a ballot-only election and is calling the legislature into session tomorrow for that discussion. I want to applaud the decision. I spent a bunch of time talking to the governor last night about this, and I know he's heard from folks, who want to go ahead, and there's different opinions. There's parts of the state that haven't yet experienced their first case yet, and to them it might seem like an abstraction, but I can only say it is a colossally important and right decision. I fully support it, and I strongly urge every member of the legislature to support the governor in this decision. This is not a Republican or Democrat issue. This is about saving lives. This is about citizenship and caring for your fellow human being and compassion in its truest form. We need to prevent that in-person transmissions that will happen if we don't pass this. So again, I applaud the governor's decision and strongly urge our friends in the legislature to support that decision. As you also may have heard, we have our first confirmed case at the House of Corrections in Milwaukee. Houses of corrections, jails, facilities like that, as has been noted for some time in the coverage of this epidemic, are particularly vulnerable to transmission, and we've had a run of good luck. This case was quickly identified. The person has been quarantined. And you'll have the opportunity to hear a lot more details about it because Superintendent of the House of Corrections, Michael Hafman, is on the call. So when we get to questions, people can talk to him about it. Secondly, we're going into the second weekend of the governor's safe at home order, and it's sunny outside, and I know people are probably already feeling stir crazy and they're going to want to go out, but the importance of social distancing not only remains high, it's gotten higher. 2 weeks ago we were talking about numbers that were 2 digits for confirmed cases. We just passed 1,000. We're going to continue to grow that number, but we can control it if people continue to practice social distancing. So when you hear from Guy Smith, who's our parks director, he's going to talk about some changes we've made, and it is just crucial that people who feel the need to get outside, which is understandable, just follow this protocol and absolutely maintain social distancing. Also, as we reported here on one of these calls about a week ago, transit continues to adjust based on our needs. Our overall ridership is down between 60 and 70%. And so we reduce service levels accordingly, but maintain service for essential workers. And we've kept a close eye, and we'll keep doing that and adjust where we have to. But because we had heard some reports of occasionally certain routes had buses where it was harder to do social distancing, we've added more buses on those routes. I want to remind people, take the bus for essential needs. If you've got a job that you've got to get to that's allowed, if you've got to go shopping, if it's a doctor's appointment, whatever, that's fine. And if you see a bus and it looks like it's too crowded, one, let us know. Well, actually, one, wait for the next bus. But two, let us know, because MCTS is closely monitoring and will keep adapting because we want to get this balance right. And I believe that is what I've got beyond the usual reminder that we've got a great group of public servants, many of whom are here on this call, and the amount of work that is getting done and the coordination and collaboration have been fantastic. So with that, I'll turn it over to the mayor.
Thank you very much, Mr. County Executive. I just got off a phone conference, one of these Zoom conferences with Dr. John Raymond from the Medical College, as well as some business leaders. And one of the points that Dr. Raymond made during that conversation, which I think is very, very worth repeating here, is there's been a lot in the media the last couple of days about face coverings. And his strong words of advice were, please reserve the well-fitting N95 masks for our frontline workers. That those are the individuals who are really putting themselves on the line and have the most exposure. If you're going to cover your face, and you thought it was a good idea to cover your face, if you're going to cover your face, you can cover it with a scarf, you can cover it with something else. You do not need, according to Dr. Raymond, you don't need one of these clinical masks to do it, but it is good to do it. But he cautioned that if you're going to do that, to make sure you're not touching it. And again, to make sure that you're washing your hands. So just as the county executive said, the stay at home, the social distancing is very, very, very important. Here, it's another gorgeous day. It's springtime. It's springtime, which means we all want to be outside. Everybody's got spring fever. But if we're going to get this under control, and again, Dr. Raymond had some data that showed that because of the steps that we have taken here in southeastern Wisconsin, in Milwaukee and Milwaukee County in particular, he felt more optimism in terms of the slope of the curve that was starting slowly to start going in the right direction. We're still seeing a doubling of cases approximately every 4 days. We want to stretch that out as much as we can before it ends. But we know that the social distancing, we know the steps that we have taken already have proven to be productive. And I think that that's something that's very, very important, that we acknowledge and thank everyone who has been helpful in helping us deal with the problem. But there is still a problem. And I think the problem, because I just got another message from a faith leader who wanted to have a special service on Easter. There is no exemption to this disease for being with people that you love and trust and respect. And what I mean by that is that I think we have a human tendency to think, well, I was just with my close friends. I was just with my family members. I was just with the people that I worship with. I was just with the people that I vote with. And that somehow, because you're with people that you love or you respect or you like, that you're not going to get the disease. What we have seen over and over again, that oftentimes that's when the disease is spreading the quickest, is among people who want to be together, and somebody gets infected and they share that with everyone else. So that underscores, again, the need for the social distancing. The county executive brought up the fact that the governor has called this legislature into special session. I would ask all of you to please contact your legislators and ask them to support, first of all, the decision to be in special session tomorrow at 4 o'clock. And second, to take the steps necessary to protect election workers and to protect individuals that vote. And this is not just a Milwaukee issue. We're seeing it throughout the state of Wisconsin, where municipalities, small municipalities, can't get the election workers. We've seen it in cities like Green Bay and Racine, in Kenosha. We see it in some suburbs like Oak Creek and Waukesha. So it's a problem here in the city of Milwaukee, but it's a problem throughout the state of Wisconsin. But I do want to focus for 1 minute as to the seriousness of the problem here in Milwaukee. Because of our inability to get poll workers, and I'm not critical of a single one who decides that they're not going to be there, we have been forced to have fewer election sites. And the commissioner can talk about this because she weighed in on this earlier today. Neil Albrecht, our election commissioner, has done a fabulous job in an impossible setting. But because of the restrictions that we have in getting poll workers and the inability to attract poll workers, we are at this point planning on having 5 sites. That in and of itself is a problem from a public health perspective. And so when Commissioner Koala came in and looked at it, what she concluded, and I'm very supportive of what she'd said, was that she contacted the state and said that if she had the authority, and she doesn't have the authority because the state took it away, if she had the authority, she would say that you can't do this. And that's the right public health decision. Because we are going to have voting locations in areas where we have high concentration, relatively speaking, of people who have tested positive for the virus. That is not good public policy, and that is not what we should be doing. And so, again, I ask you to contact your state legislators and ask them. And from my standpoint, this is not a postponement. This is a continuation. This is a modification of the election. And what I mean by that is we all know that people throughout the state have already voted. And that's a good thing. I want people to vote. And I want to stress that over and over again. I want people to vote, but I want them to be safe when they vote. And the fact that the public health experts are saying that this is not a safe situation is something that we should take heed of. So again, we have to practice our social distancing in all aspects of our life, all aspects of our life. And I think that that's very, very important. I also want to make another request. Our Assistant Fire Chief, Chief Lipsky, said that the donations for the personal protection equipment, the drop-off site at State Fair Park, have been going down. Again, we're still looking for that personal protection equipment. If you have it, please do what you can to help us there. I think that that's very, very important. Yesterday, during our conversation, the issue of long-term care facilities came up. And as I said at that time, Commissioner Kowalik, I felt was a person who was best suited to address that. And the reason this is important, I think we all recognize, is because nationally we have seen some of these long-term care facilities being places where there were high incidents of positive readings and of illnesses and deaths. And so I thought it would make sense for us to have an update from the commissioner to talk a little bit about what we're experiencing here so that people have an understanding of the scope of the challenge here and exactly what the state of the situation is. So with that, I'll turn it over to Commissioner Koala. Oh, no, I'm sorry. Before we do that, we go to Dr. Ben Weston. I apologize. Dr. Weston.
That's fine.
No problem. Thank you, Mr. Mayor. Good afternoon. Looking at our numbers, as County Executive ably mentioned, we've reached a new and concerning milestone at over 1,000 confirmed cases of COVID-19 in Milwaukee County. 1,023 individuals tested positive at this point. At the same time, we saw a dramatic and upsetting increase in deaths to 24 individuals. Our trend in COVID-19 cases continues steadily upward. While all parts of our county have been affected by COVID-19, there is no doubt that specific communities have been harder hit. The high rates of COVID-19 that we are seeing should concern every member of our community and give strength and urgency to the message to stay home. There's confusion, I think, out there as to the contagiousness, the severity, the immunity regarding COVID-19. So I thought it would be important to go over some facts. So COVID-19 is twice as contagious as the common flu. It can be spread by close contact, such as being within 6 feet of an infected person for a prolonged period. Many people are contagious before they show any symptoms. So you may not have any symptoms. You may feel perfectly fine and still be able to spread the virus. And this is why social distancing is key. Even when you have to go to the store, try to keep your distance from those around you. And even if you wear a mask, keep your distance as well. COVID-19 is 10 times more deadly from the flu from what we've seen. We've seen 24 deaths in our community and nearly 7,000 deaths in the United States. And we'll see many, many more deaths in our community. The best projections we have right now suggest close to 1,000 deaths in Wisconsin, just in Wisconsin, in the next 2 months. And that number, that projection, is assuming strict social distancing. But through strict social distancing, that's the only way we can keep that number as low as possible. It's also important to know COVID-19 doesn't discriminate in who gets infected. You can get COVID-19 whether you are Black, white, male, female, young, or old. Progress is being made, but right now, despite what you may see in some media sources, there is no cure, there is no vaccine, and there is no vaccine that appears to be coming right around the corner. So no matter your age, your health, please take this seriously and stay home. COVID-19 is killing members of our community at an increasing and alarming rate. Please also, as the mayor mentioned, continue to support those working so hard to help you. Donate any new or unused personal protective equipment to our State Fair drop-off site. It's 7 a.m. to 7 p.m. Every day of the week, including the weekend, at the Tommy Thompson Center on 84th Street at State Fair. We're distributing that equipment to help protect our healthcare providers and our first responders and our other workers in need, to ensure they can protect themselves and also to ensure they can protect their families from COVID-19. Thank you, and stay safe.
Good afternoon, everyone. So we're at the 3-week mark. So again, on Friday the 13th in March, we had our first case, and now we're at 3 weeks and about 1,000 cases for the county and about 800 for the city. As far as those that passed away due to COVID-19 infection, the county's now at 28 and the city's at 24. I just wanted to provide some breakdown a little bit, again, reiterating what the county executive said about the impacts of race and inequities for COVID-19. And there's a number of national articles that are in the process of coming out, aside from those that already were released. But just giving you a sense of how important it is to spread the word that staying home, social distancing or physical distancing, and then just taking whatever precautions you can take to prevent the spread in your household. And if you're an essential worker and you have to go out and about, ways to prevent contracting COVID-19. So Milwaukee's population for African Americans is about 47%. But then when we get to where we're at right now for the case percentage, it's about 50%. For those that are in the hospital, it's about 62%. And for those that have perished due to COVID-19, it's about 87.5%. So you can see where we're going here. We can do something about this. We need to just continue to increase outreach and resources. And we've been talking to a number of partners across the community, virtually, of course, and over the phone, to help galvanize all of these efforts in the community to bring awareness to individuals that may not think that they're at risk for contracting COVID-19. Also bringing in other partners that we haven't worked with before that can help spread the word is very important right now. And then looking at, again, these people in our community that have underlying health conditions, such as myself, that are more at risk from complications or death related to COVID-19 infection. So I also wanted to speak to the long-term care situation, as the mayor noted, because I know we received a number of inquiries about this and what is really going on in the city of Milwaukee and Milwaukee County. And pulling data, of course, is a challenge because we are actually working on our response. So I always want to take a moment just to acknowledge the Milwaukee Health Department and Suburban Milwaukee County Health Department partners, as well as those in the southeastern Wisconsin area that are working day in and day out on the response for COVID-19. It is very daunting and stressful work, but we have to do what we can to try to prevent the spread of COVID-19 and additional disability and death related to infection. So let me give you a sense of where we're at for the county. Okay. So again, when you look at long-term care facilities and people that reside in long-term care facilities or work in long-term care facilities, the majority of individuals are considered high risk that live there or work there because they're exposed to these individuals. So people that are over the age of 60, people with underlying health conditions or disabilities are most at risk for some complications or death associated with COVID-19 infection. So according to the State Department of Health Services, there are 19 licensed nursing homes or long-term care facilities in the city of Milwaukee and 35 in Milwaukee County. So when we look at outbreaks, because that was a question. So are there any outbreaks in long-term care facilities in Milwaukee County or the city of Milwaukee? We will not release names of facilities. We will give you a general sense of what's going on. So at the county level, 4 of these facilities have been considered to have outbreaks, which is defined as having 2 or more cases of COVID-19. You may wonder why that number is so low, but from a public health position, when you have something like this, a novel disease, it can spread very quickly in confined spaces. So of the 4 facilities in a county, looking at the number of facilities in a county, this represents about 11.4% of all nursing homes or long-term care facilities in Milwaukee County. Now for the city, we have 3 that are currently considered having an outbreak. And when you look at the math again, 3 and then 19, it ends up 15.8% of licensed nursing homes or long-term care facilities currently have an outbreak. So, as far as looking at what does that mean? We have loved ones that are in facilities. We have loved ones that work for these facilities. And the facilities management has been tasked with a number of disease prevention methods, such as prohibiting visitors and other additional measures as far as cleaning and things like that. So the health department supports these initiatives, but again, we're not going to put out a list of names of long-term care facilities or nursing homes that currently have these infections. I look at it like this. So public health, again, is responsible for a number of things, one of which is regulating. The state regulates nursing homes or long-term care facilities. We support that. But in our local jurisdictions, say for instance, we regulate restaurants and bars, food inspection. We don't publish all of the restaurants or all of the bars that have violations or that we're shutting down. You can access that information through our website, or we have individual news stations that pull that information and do exposés and whatnot. The state monitors the nursing homes or long-term care facilities, so they have a master list of this information. So again, I just wanted to stress that because we received so many questions about it and we weren't hiding anything. It was a matter of us being so busy in the response and doing the work that we weren't able to turn that information around by the deadline when it was requested. So that's pretty much all I have, other than the usual reminders on social or physical distancing, remaining 6 feet from another person if you have to go out. We're getting complaints from others in the community and store owners of people jamming into facilities. And please, by all means, do not do that, because you're making yourself exposed and putting yourself at risk of contracting COVID-19. Also, individuals that need to get some exercise, maintaining distance while you're running, jogging, walking your dog, pushing your stroller, whatever it may be, that you're not congregating or jamming up in spaces. Also, I know that the parks will talk a little bit about what will be done in addition to what has already been done. We know that it's nice outside. We've been waiting for spring, but the playing outside, like there's nothing going on in the world right now. We highly, highly discourage that because we know, especially with children, that children can be carriers for this and children can be impacted negatively by COVID-19. We're seeing some additional information from other places across the country where children are being impacted and hospitalized. Even an infant died recently in the state of Connecticut. So again, we're promoting prevention by social distancing or physical distancing, and then promoting personal hygiene, hand washing, not touching your face, your eyes, nose, or mouth. And then if you're under the weather, removing yourself from others that you may be around, say if you live with other people in your household. So thank you.
Thanks so much, Commissioner Kowalik. So next we're going to hear from Guy Smith, who's the director of the Milwaukee County Parks.